off, can you tell us where your practice is located and a little bit about yourselves?
We are in beautiful Tucson, Arizona, kind of in the heart of Tucson. We just started our practice here. I was in Austin prior to moving out to Arizona, and Dr. Mahabir was in Scottsdale, and we just started our practice together in January, so we've loved it ever since.
It's such a beautiful area. I'll have to come visit you at some point. Oh gosh, that sounds so wonderful. So to jump right in, I know we have a lot to unpack today. Can you all start by telling our audience a little bit about what breast implant illness is? And also, just to reiterate, this is also known as BII.
Yeah, I think first and foremost what I want to say is that breast implant illness, or BII, the most important message that really needs to get out there is that it is real. It's real and it's affecting women, and that's really the reason we're doing this today. What is it? Well, it's when the women that have breast implants, the small subset of them, when their breast implants are actually making them sick. By making them sick, it can be any number of symptoms, from their hair can be thinning, problems with their eyes, problems with their joints, just generalized fatigue, pain, discomfort. The symptoms, the problems that are making them sick is actually very non-specific. It can be any number of things, but it's when their breast implants are making them sick.
And I find this very topically relevant. Like I said, we get a lot of questions about it. And also, I just wrote an article last week on NewBeauty.com featuring Claire Crawley, who was the former bachelorette. She just spoke out about this topic as well. And we were getting a lot of reader feedback on that. So again, very timely discussion we're having. Can you talk a little bit about who might be somebody that gets this? Is it everybody who has breast implants? Who would be the person that should look out for this?
Well, really any woman who has breast implants, whether they're silicone gel or saline, it doesn't really matter, is potentially at risk over her lifetime. We don't really have any known indicators of what makes somebody susceptible or how soon. We've seen it in patients early after their implants, and we've also seen it in patients that happens many years after. So it's just something that women have to think about and be aware that if they start to notice changes in their health or things are starting to change, that they might want to revisit that and think about that as a potential source of their problems.
So in terms of treatment for this, because I know it can be very tricky when the symptoms are all over the place, and I know a lot of doctors, if the patient goes to their primary doctor, they may not know what it is. So what do you recommend the treatment for this to be? And I know there's something called explant surgery, which is when you have your breast implants removed. So where do you kind of start when a patient comes to you with these symptoms?
Yeah, oftentimes by the time patients get to us, they've seen everybody else, because they don't put it together that it could be their implant. So they might have seen their neurologist, their rheumatologist, their primary care doctor. But once they get in to see us, the treatment for breast implant illness is to remove not just the breast implant, but all of the tissue around it, meaning all of the scar tissue. Your body knows that implant's not supposed to be there, so it walls it off. It creates medically we call that a capsule. So the treatment then is to take out the implant and the capsule to make sure you get all of that material out. And it's great for us as surgeons to kind of say those things, but we have the unique opportunity. We have Morgan here, one of our patients, and she wanted to have we wanted her to have a chance to speak to everyone who's listening and watching, just to see really what it means as a patient. So we're gonna have them switch seats just for a minute, and let Morgan answer a few questions as well.
I'm so excited to meet you. Thank you for joining us, Morgan.
No problem. Thank you for having me. I'm so excited.
This is great. So I know Dr. Mahabir mentioned that you had, experienced BII yourself. And so I believe you had the explant surgery performed, right?
Yes, ma'am.
And how did you decide? Oh, sorry, what did you say?
I said about 10 weeks ago.
Okay. And how did you decide that that was the right process for you? Can you tell us a little bit about your experience?
Sure. So I got my implants about 6 years ago, and 3 years ago, my health started declining, unexplained things going on. Then about 6 months ago, I would go so far as to say that my health was failing. I couldn't eat, I was losing weight, My anxiety, depression got unmanageable to the point that I wasn't functioning. So I found out about breast implant illness through a Facebook support group called Breast Implant Illness and Healing by Nicole. And when I got on there and started reading stories of women with implants and explants as well, everything was hitting home. I had over half of the 60 symptoms, and I started connecting dots. And I was lucky enough that, I found Dr. Mahabir, and he saw what was going on. He saw it for what it was, told me, I definitely think that this is what's happening with you. And I had this deep gut feeling that it wasn't a matter of if something was going to go wrong or be worse. It was just a matter of when things were going to get worse. So for me, explant was the only choice at that point. And when I found out about breast implant illness, I was really scared. I was upset, and I felt out of control. And explant was a way to gain control over the situation, my body, and my health. So, yeah.
What was the, I imagine that, like you said, this was a very scary time. What was the like procedure like for you and the recovery, and how did it make a positive impact in your life? Like, would you say that it was worth it, and would you urge other people to explore this option?
100 times over, 100 times over. I'm a huge explant advocate now. So the process, like I said, once I found out about breast implant illness, it was really easy for me to make that decision to do it. The surgery itself went great. The recovery, it's a surgery. It's a major surgery. It's tough, but I've told Dr. Mahabir that any bad day that I've had post-surgery is still 100 times better than any good day that I had with the implants. So it has 100% been worth it for me to get them out. They were killing me.
So have you noticed any changes in the symptoms? Like, what would you tell somebody, because it's probably different for every single patient in terms of what they experience afterwards. What would you tell somebody who's looking to go through this in terms of, the recovery in terms of symptoms declining?
Okay. So again, my experience has been immediate physical relief. I was suffering from fatigue that I couldn't get off the couch anymore. So now that I can get up and be with my kids and spend time, and I have this energy that I didn't have before, I'm like, how did I get through the day? So the energy, the brain fog, I felt with the implants, and I didn't realize it at the time, but it felt like I had a wool blanket over my brain at all times. And upon waking up from surgery, my mind was clear. I felt like a new person. My muscle aches were gone. I was getting migraines daily with the implants. I haven't had any headaches since then. Just so many instant physical symptoms have been relieved. And like I said, that's been my experience. I know that for other people, it takes longer. You're detoxing heavy metals out of your body. And so it's a process. And, I know that there will be days when maybe I don't feel the best, but mostly, I would say 90% of my symptoms that I was experiencing that were negative are gone.
And how important is it to choose a doctor like Dr. Mahabir to help you through this process and to make sure that they are qualified to perform a procedure like this? Did you do a lot of research?
Yes. So on the Breast Implant Illness and Healing website, Facebook group that I told you about, there's a list of doctors and people recommend. And, it was really important to me to find somebody that believed in what I was feeling and saw me. So I would say that wait until you find the right fit. If you're not finding somebody that believes you, keep looking, just keep looking. And when you find the right surgeon for you, you'll know. And I knew, and I was lucky enough off the bat that Dr. Mahabir really recognized what was going on and made me feel seen and heard. And I think that's really important. And if you're not getting that from the person you're talking to, don't settle. Your health is important. You need to be your own advocate. And I'm here to tell you, you will find somebody that will see you, believe you, and help you. And Dr. Mahabir was that for me.
That is so wonderful. I totally hear everything you're saying. And I think that, I can see from the comments here that people are really, appreciating this information and this encouragement. And I love that you found this through a Facebook group, because people need to know they're not alone. A lot of women experience this, and finding a sense of community is so important to help you through it. And then also finding a qualified surgeon who's going to have your back through every step of the way. So thank you so much. Is there anything else about your experience or any other words of, advice that you would like to share?
Sure. I would just like to say, your confidence, not to sound cliche, but your confidence is not something that you can buy. It's not something that you wear on your chest. Small boobs, big boobs, no boobs. You're worth it. You're worthy. And if you're considering explant, you're considering the fact that you could feel better without them. And I'm here to tell you that for me, that has been the case. You're not alone. And, if there's anyone telling you that this is in your head, these things you're experiencing are not real, there are people out there that are here for you to tell you that it's real, it's happening, it's not in your head. Just be your own advocate and you will feel better. You will. So that's my message, I guess.
Amazing. Thank you so much for joining us.
Thank you for having me. I really appreciate it.
You're so welcome, and appreciate you, Dr. Mahabir, for arranging to have Morgan on, because I do think that this is very important, and this was wonderful. So thank you.
All right, we're gonna trade seats
All
again.
right.
Musical chairs.
Oh.
So back to the technical part of this, because our audience is very savvy, and I know that they're very interested in the actual procedure part of this. So I'm curious, you mentioned, Dr. Mahabir, about how you have to remove the entire capsule surrounding the breast implant. Can you talk a little bit about what the surgical options are? And perhaps, I know that there are some doctors who don't necessarily offer all of these options.
Yeah, go ahead.
Oh, sorry, you answered that one.
Oh, okay. Well, yeah, so I said it before, and the important part is to get all of the tissue out. And that's why it's important that your doctor actually believes in what he's doing, or she believes in what they're doing, because you can do what's called a total capsulectomy, where all of the capsule is removed, but it's not necessarily removed in one piece. And sometimes that's necessary, and sometimes you can do what's called an en-bloc capsulectomy. That's more of a cancer term, where you don't just remove the implant, you remove all of the scar tissue, and you remove it all as one piece. No matter what people say, that's not always physically possible, depending on where it's attached to, the rest of your anatomy. So whether or not you can remove it en bloc is less important, in my opinion, than just making sure that you remove it all.
Okay. And I think we did talk about this a little bit with Morgan, but from your perspective as healthcare professionals, what is the recovery like? And I know I mentioned this, not every patient has the same recovery, but do all the symptoms just go away?
Well, I think I'll answer that one. So, some patients like Morgan have this dramatic, almost overnight improvement, and that's really kind of gratifying to see. But unfortunately, some patients don't have sort of that dramatic of a response. Some of them, I think more frequently find that they have some symptoms get better right away. And then, some other symptoms, it just takes more time. I think it's just variable. And some patients don't fully get better. And that's what's kind of challenging with what we're seeing, is we don't really quite understand everything that's going on with the sickness and what's, exactly causing it and how it all works. But it is on a spectrum. So I think everyone has to listen to their intuition. When they know it's time to get them out, you get them out and be patient and go from there.
And if I could add a little bit of science to that, because breast implant illness is an important topic, we're actually studying it, and you're starting to see scientific papers now get published on it. And probably one of the most important papers that's been published so far is a group that studied the breast implant illness patients and studied them before and after the removal of implants. And what they're able to show is that if you really do have the symptoms before and you take them out, and you're taking them out for the right reasons, 80 to 90% of people are going to get better. Like Dr. Kurtovic said, it may be right away, it may be 3 months, it may be 6 months, it may even be a year. But if you watch people and follow them long enough, most people will get better.
Okay. No, it's great to know. And like you said, this is a relatively new area of research. At least, the public hasn't heard that much about this until recent years. And I know we've done a lot of work to cover it in New Beauty and to educate our readers. So we appreciate you sharing some of the science, because I know our readers definitely care about that as well. Um, what I would like to also ask is, we get this question a lot, is about insurance, because this is very important for people. So is this something, I know, is there like a formal diagnosis for this? Is this something that insurance covers?
Yeah, so this is another hot topic. Unfortunately, at this time, there is no ICD-10 code for this. ICD-10 code is insurance's way of saying, they have a code for everything. There's a code for a rattlesnake bit my toe. There's a code for that. And so if that happens, insurance will cover it because there's a code for it. As of right now, there's no ICD-10 code for breast implant illness. And so when you submit it to insurance, they just say, well, this doesn't exist because there's no code. We all know it exists. Morgan is proof that it exists. And there's thousands of patients like her that prove the proof that it exists. So there are many of us that are working very hard right now to get an ICD-10 code. As of right now, there's not one.
Okay. And I think another huge question is, are breast implants still considered safe? We're having all this conversation about illness and, very scary things that could happen, but the majority of people who get breast implants are very happy, right?
Yeah. We have to, again, go back to the science of it. And let's take the breast cancer and reconstruction group as a different example. For women that lose their breast to breast cancer, the options for reconstruction are fairly limited, and depending where you live, implants may be your only option for reconstruction. And so are they safe for breast cancer reconstruction? Absolutely, they're safe. But like any medical device, like any procedure, they're safe in the context that they're not for everybody and they don't work for everybody. And so getting the information before you get the breast implants of what can go wrong, that's what's so critical, because then if something starts to go wrong, you don't go looking for your neurologist or your rheumatologist. You say, oh, it could be my breast implants. And wow, I better go back and see my plastic surgeon and talk about this.
Right. So in terms of, we talked about having a sense of community, which Morgan mentioned with the Facebook group. You just mentioned, if you have implants and you start noticing these things, go to your plastic surgeon. What I could see there being women who think, well, I only have a few of these symptoms and there's 60 on this list and maybe I shouldn't have it checked out. How can you make them feel confident that it's better to be on the safe side than sorry?
I think if you're ever worried about those things, then just go and see your plastic surgeon. It's a conversation, and it should be a conversation, because there isn't going to be a right answer. There's pros and cons both ways, but until you sit down and have that conversation, you understand the risks, you understand the benefits, how can you make an educated, intellectual decision? So get the information you need to be able to answer that question for yourself, and if you're not getting it from your plastic surgeon, go see another one.
Yeah, that's very good advice. And I agree. I think getting as much information as you can to make the best educated decision for yourself is key, because it's very confusing. It doesn't mean you have to have them out if you have some symptoms. Again, it's going to come from an internal decision that woman will know, and if she gets the information, she can kind of put it all together, because not everybody with breast implants, when you take them out, is going to necessarily have aesthetically a really good result. And sometimes some patients end up with a deformity that can actually be more traumatic than with the implants in. And so that's another kind of special group of women that we see too. And, give them the options, they get the information, and then they can make a decision. Sometimes they take them out and they see, what, maybe I get better, maybe I don't. And they sometimes come back and we put them back in. So it's a process. It's not a clear black and white, but getting information, having a good relationship with a plastic surgeon that's going to advocate on your behalf, I think is the most important, like Dr. Mahavir said.
And we have a question coming in that says, how often should we see our doctor for a general breast checkup? I'm guessing this is somebody with implants, but what would you say with and without?
So, how often? Well, there depends on kind of what your take on that is. I'll give you my take on it. My personal take is I like to see my patients at least once a year. Admittedly, sometimes those are just social visits, checking in. How are you doing? How's everything working? Check that the breast implants aren't having problems. So personally, I like to see my patients once a year because I like my patients and I like to know how they're doing. So that's what I would say. What does the FDA say? Well, they say you need to have imaging of your implants every 3 to 5 years. So
Okay.
kind of different answers for that question.
Okay. And then we have another question. What about fat transfer after breastfeeding to give fullness again? This is obviously, not necessarily related to BIA, but also in a way it is, because one of my questions for you is, what are the options that women have after you take the implants out in explant surgery to give some sort of fullness back to the breast?
So typically, it starts off with assessing how much breast tissue the patient has, but what ends up happening, depending on the size of the implant and how much breast tissue they have, sort of determines what option is for them. But fat grafting sometimes is all you need to do to give them just a little bit of extra thickness, fullness. It won't be able to replace a lot of volume, but it often gives them just enough where they feel, more of themselves. And I think it's always worth it to do fat grafting if they can. And then in other situations, doing a lift at the same time. So it all depends how big their breast was to start with, how big the implant is, how much breast tissue there's left. But in the ideal world, if a patient comes to me who wants her implants out and I see she's got a good amount of tissue, we can do a lift and do some fat grafting, I can usually get a beautiful result with that. But unfortunately not everybody is in that category, so it just depends.
And can you explain what fat grafting is for those who don't know?
Yeah, I was going to say,
Yeah.
the beauty of fat grafting is it's a win-win operation for those that at least embrace it or want it, because you get to take fat from someplace on your body where you don't necessarily want it, and you're effectively transplanting it to somewhere you do. And fat grafting with our current techniques, the success rate is very high, and it's your own tissue. It's not going to make you sick. It's not going to give you problems. And Dr. Kurtovic said it very well. It does not replace an implant. Like if you have a 500 cc implant or you want really big breasts and you have small breasts to start, no, fat grafting can't do that. But it can enhance what you already have. It can help to optimize your shape and size. But again, it's win-win because you get to take it from somewhere you don't really want it.
And we have another question, is fat transfer permanent?
It is permanent. When it's done really well, you can get up to 70% of retention of the fat. So usually we'll overfill a little bit knowing that we'll lose some of it, but almost all of it will survive nowadays. And also, in some instances, some patients opt to have more than one fat grafting procedure, which is really nice because that'll just enhance it every time you have it, and you can really get a lot more volume.
So you're talking about having one fat transfer procedure, how long would you have to wait, and then doing another one?
3 to 6 months.
Okay.
Yeah.
Okay. And we have another question. What is the recovery time from fat transfer?
If it's isolated to just fat transfer, that's actually a fairly straightforward procedure, meaning you do liposuction to suck fat out of where you don't want it, and then you make tiny, tiny little poke holes to re-inject the fat. The fat is micrografted, so it's not big blobs of fat we're injecting, it's little tiny droplets. So effectively, you can go back to work the next day if it's just fat grafting. Now, if it's implant removal, and a lift, and fat grafting, no, there's more recovery to that. But fat grafting alone is actually very quick recovery.
And what is the process if you're having the explant surgery and you also want fat grafting and you know that going into it? Can everything be done at once, or do you have to wait after the breast explant surgery?
It can be definitely done at once, and we favor that because you're already going in and having one anesthesia, and the more times we can do fat grafting, the better. So if we can do it, we will absolutely recommend doing it at the time of the explant and lift.
Okay. And another question that we've gotten from readers is, when you take the breast implant out and say you don't do anything at all, like fat transfer or a lift or anything, what does the breast tissue look like after it's had an implant in all those years?
That's a really tough question to answer. That's the one where you really need an in-person consult, because everyone's breasts looked different before they got their implants, and what you looked like before you got your implants still may not even predict what it looks like afterwards, because maybe subsequently you've had children, maybe you've had some weight gain, weight loss. So an in-person consult, your surgeon can kind of do an exam, assess your breasts, tell you how much tissue you have of your own, tell you how much droop and sag you have, and then kind of give you a rough picture of what it's going to look like when we take them out.
Okay. And how many patients of your explant surgical population, we should say, how many of those patients prefer doing another operation after to increase the fullness versus just leaving their breasts alone? If you had to guess.
The majority opt for that. I think that sometimes finances, make decisions in the sense where they might not opt for it if it's financially just they're not in the place to do it, so they just want to take the implant out. But most of the time, they want to do as much as possible to optimize the breast. Which makes sense.
And explant patients are doing a fantastic job of networking, getting the information out to them, to other patients, to other people with implants. So you can see that, because 10 years ago when we were doing explants, they would come in and that wasn't even a topic for discussion. That basically didn't come up until we brought it up. Nowadays, patients come in talking about explants already saying, can I have fat transfer at the same time? So that information, that message is definitely getting out. And I agree. I think it's the majority of our patients that get fat grafting.
I love when you say the information is getting out, because sorry, go ahead.
I was interrupting you. No, I just wanted to add to that. I think as a tip for women who are going to be considering a consultation to talk about explant, I think it's a really good idea to ask to see pictures, what it looks like in the worst case scenario if I don't get a lift, some patients are worried about the scarring and they really don't want the scars, but it's good to sort of see what they might be expecting or what their result could look like. I think that really helps.
Yeah, no, that's very important. So do you all have before and after images of these procedures as well?
Yes.
Yeah, we host them on the NewBeauty website. You guys have a wonderful website, and we've put some before and afters there. We have them on our website, TucsonPlasticSurgery.com. But if I could circle back, because I thought you were going to ask us, I heard you were going to ask us about getting the information out there. And
yes.
I know you also, again, NewBeauty had a wonderful article on this, but Arizona, the state of Arizona, is leading the country on this. We recently helped work on a bill that has now been signed into law by our governor, and effective January 1st, 2022, any woman in the state of Arizona who's getting breast implants will have to get not only these books, because every woman is supposed to have gotten these books about their breast implants, and it really goes through a lot of great information. But a book is not necessarily enough, because maybe they read it, maybe they don't. But in the state of Arizona, they're going to have to be told about breast implant illness. They're going to have to be told about breast implant registries. And whether surgeons agree with it or not, whether they believe it or not, it's not up for debate anymore. It exists, it's real, and in Arizona, it's a law. So every woman should be getting this information.
Wow, how can we get more states to participate in this program?
Yeah, the breast implant illness group is
It's happening.
going viral with this. I mean,
Yeah.
they've seen how it worked in Arizona, and they're taking it now to states across the country and really pushing it forward. So.
Okay, good. And I did mention this at the beginning, but and you just reiterated as well, but we do have a lot of articles and good information from our top doctors like Dr. Mahabir and Dr. Kudovic on our website at newbeauty.com if anybody is interested in learning more about BII. So I'm also curious in terms of just breast surgery in general. Obviously, we're talking about BII. I did mention, the majority of patients who get breast implants, like they are still safe. I just want to open the floor to you to reiterate, you know, with breast surgery, what to know before you go in to feel confident that you're making the right decision, and not be scared if this is something you still want to do.
Yeah, whether you're in Arizona or not, and whether it's January 1st, 2022 or not, you should be getting a breast implant book. The FDA mandated that years ago. That's not a new recommendation. Every woman that gets breast implants, before she gets them, is supposed to get those books weeks in advance of their surgery so they have time to read them. And if you read them, in the back of the book, there's actually a page that says, I've read this, check. I understand it, check. I've reviewed it with my surgeon, check. And the patient signs it and the surgeon signs it. If you're not getting that from your surgeon, ask for it. And ask why you're not, because there should be a good reason, because you should get it.
That's great. And you mentioned the registries. Can you just tell everyone what that is exactly?
Yeah, there is a national breast implant registry in the United States, and actually it covers North America, so it covers Canada too. And every woman that gets breast implants has the opportunity to be registered in that registry, and I would argue that everyone should be, because you know there's a great example just 2 years ago. Textured breast implants were recalled across the country. We knew that they were causing a cancer, and textured breast implants were recalled. Anyone that was in that registry would have been notified right away, hey, we now know there's a problem with the implants that you have, you should go see your surgeon. So the registry is for future problems that we don't even know about. Yeah, we knew about breast implant lymphoma. We know about breast implant illness, but there's things we don't know that we will learn about. So for us, every patient that comes to see us, we automatically register them in that registry. And the registry is actually wonderful because patients can access it. So there's a patient portal to it. So you forget your implants, you lose your implant card, you can go online and get it now. So these registries are getting better and better all the time. And yeah, again, just ask your surgeon, am I going to be in the registry? I'm not. Why not? I want to be.
Okay. That's great information. We had some great questions here today. I think we answered all of them. Is there anything else on this topic or just in general about breast surgery or your practice that you'd like to share?
I think hearing all of this, I think, Brittany, you were kind of mentioning that overall breast implants are safe, but there are some things that you want to think about, but not to scare the community and say, you know, this is going to happen broadly and, you know, beware. It's just to get the information out there. We do a lot of cosmetic and reconstructive breast surgery. We put in a lot of implants. We take a lot out, but we still put in more than we take out. And most patients, the majority, do well long term. So,
Brittany, we really want to thank you for giving us the opportunity to do this, because the message we wanted to send, and I think it came across today, I hope it came across today, is that this is about Morgan. This is about patients. It's their journey through all of this, start to finish, and we're here to help them on that journey, and so we're just proud to be part of it. So
and learn too. I think, you know, I think for both Dr. Mahavir and myself, you know, we're really passionate about women's health, and we love what we do as plastic, cosmetic, and reconstructive surgeons, but you know, we don't know. We want to be on the forefront if there is any groundbreaking changes or what the patients are experiencing. And I think that we really pride ourselves in trying to understand and feel from patients firsthand what they're going to and then what they're going through. So then that way, you know, we can be part of the bigger community in terms of educating the medical community, surgical community, and being part of the changes that need to take place.
And we're grateful to you all, because without doctors like you filling, you know, our editorial team in on, you know, these changes and these updates and the science, all of this information, you know, funneling that through to our team, we're so grateful for that, so that we can keep our readers up to date on everything as well. So I'm grateful for doctors like you to be partners with us. We're thankful to have you on our team and appreciate your time today. And where can everybody find you? What's your website if they want to learn more about your practice?
TucsonPlasticSurgery.com. We're here in Tucson, and yeah, we're happy if anyone wants to come and see us.
Perfect.
And we also do virtual.
Oh,
virtual consults. You don't have to all come to Tucson. We
Yeah.
can always meet over. So with COVID and all the
Yeah.
shift to virtual, yeah.
Wonderful. Well, thank you so much, and I hope you have a wonderful weekend, and we will connect with you, I'm sure, very soon. And for anyone who hasn't seen our summer issue of New Beauty, go check it out. It's still on newsstands with Olivia Munn on the cover, and there's so much amazing information in here, plus all of our top doctor profiles. So thank you, and have a good weekend. We'll talk to you soon.
Thanks so much.
Bye-bye.
Bye.